Welcome back. The SA Medical Technology Industry Association is asking government to deal with what it says are unsustainable levels of debt owed by public sector health facilities. The group says some companies may actually have to retrench workers because so much money is not being paid by hospitals to these firms. Around 1 billion rand is now owed to just 39 of these countries. Tanya Vogt is the Executive Edit Officer at SAMED. Tanya, good afternoon to you. How's this debt increased? How did the debt levels get so high?
So, Stephen, this certainly isn't something that's recent. SAMED has actually been working on this for a number of years with our members. And what we see is over time, things get a little bit better, but then they go back to where they are. And really, the situation at the moment is untenable.
You say untenable. What's actually happened? I mean, have the debt levels gone up dramatically in the last few months, over the last couple of years?
They have gone up, and in fact, what we're sitting with, as you mentioned, was just over 1 billion rand that's owed to 39 of our 152 member companies. So, in fact, the real amount is probably double that. And the majority of the companies in our sector are actually small to medium enterprises. And so it's come to a point where they've asked the trade association, SAMED, to get involved.
So, I mean, in a situation like this, how does it work? So I imagine a hospital or whoever at a hospital contacts a company, says we need this service, we need this device, whatever it is. The device is delivered. Who's supposed to pay your member? Who's supposed to pay the company for it?
So the provincial departments of health have a head office or a finance department, and they pay the supplier. But what often happens is that on the ground, the goods are delivered to the actual hospital. And then there are staff at the hospital that have to do the processing. And then they submit that documentation through to the head office. And what we're finding is that there seems to be a disconnect in processes. There are delays, which is for some reason preventing the speedy payment of these invoices, which, by the way, should, according to legislation, be paid within 30 days of invoice. So our statistics show that, in fact, 600 million of that 1 billion is sitting in more than 120 days now.
So then where is the money? I mean, does the department have the money? Is it at head office? Is it in a provincial department somewhere?
So what we have experienced, or what our members have told us, is that oftentimes when it comes to the end of a financial year, they're told that there is no more money. And they have to wait to the following financial year, which means that what's happening is that they're paying last year's goods with next year's money. So there's a continual almost catch-up, if one might call it that.
So what happens, and I mean this happens often in, a company gets behind, a customer gets behind, and they sort of wait for new business to try and build it up. But this is government. So, I mean, there's not going to be more revenue. So that means then the risk is that government never catches up.
Well, that is a huge risk. And, some companies, I think, have met with government. I think some have actually agreed some payment terms. But if you're a small company, you rely on that revenue. And in fact, some of our members have made a very hard decision and they have stopped supply. Others have had to retrench staff. And others really some are considering closure.
Sure. I mean, the other thing is that a company would also, if your customer doesn't pay, you stop supplying that customer. But this is a public hospital. I mean, these people need these services. So it's not the people who run the hospital who suffer, it's the patients who suffer if you stop your services.
You must remember that our members are selling products that are essential for healthcare delivery. It's not like toilet paper or coffee. These items are for patients, and oftentimes these patients are in absolute dire need, otherwise they could die. So it's a very difficult decision that a company takes if they do make that decision to stop supply, because at the end of the day, they want to continue looking after patients.
Tanya Vogt, thank you, Executive Officer at SAMED. Do appreciate the time.